Are you thinking of becoming a mother? Are you thinking of giving birth to that healthy baby boy or baby girl? Did I hear yes? Then come my next question. How prepared are you? Welcome to the maiden edition of Mom Diaries. I'm Fowa, your host, and on today we are about to learn about preparation towards pregnancy. So I have with me a lovely, gorgeous guest here with me. She's very beautiful. You will love her when you see her. So you're all welcome to the Mom Diary, the maiden edition of Mom Diary Show. The Mom Diary Show is a show designed to educate us on the challenges and the various phases of mothers. Yes, mothers go through a lot, which we all do not know. We all think motherhood is about giving birth, taking care of the baby, but a lot of things that go through motherhood. So, Mom Diary is here to educate us and enlighten us on all this situation. So, as I said from the beginning, we have our lovely host in the person of Madame Rosita. Yes, she's the CEO of Tell It to Visit Facebook here. You can follow her on Facebook and Instagram. If you want to know anything about pregnancy, the yan to baby nechi or Facebook and Instagram. I walk come over church me I'm here to talk about mother. So thank you for coming, Madam Rosette.
Thank you too
Okay.
for inviting me on the show.
Oh, you're welcome. I love your dress. So,
Yeah,
okay, so when you're about to get pregnant, most of us think when you get married, once you are married, once you're a woman, stepping you need to have an intercourse with your husband or your partner. You need to get pregnant. But upon some research I came up upon, I was told, I learned that you need to have a medical checkup or go for medical checkup before you can get pregnant. How treat it?
Okay, so the question is more like preconception care, right?
Oh, okay.
Okay, so to talk about preconception care is the care that a woman is giving, or thorough investigations that a woman runs in the hospital voluntarily or per medical reports that brings out the needs of the woman's fertility and what the woman needs to do and what not to do to make sure that he or the woman, and talking about preconception care, let's not focus only on women, because if we are talking about preconception care, then it goes with the partners as well. Preconception care is not only given to women but to their partners as well, and their partners because certain times the woman might be fertile and might not have any complications whatsoever, but it can turn out that the partner might have some issues with the sperms and other stuff. So it is very advisable that anybody that is ready to get pregnant, or if you want to conceive, you go with your husband or your partner to do some investigations to see whether the two of you you really tally, or your blood level or your blood it's compatible. Everything between the two of you, it's okay that you can stay as couples to give birth. That is preconception. So preconception care, in a nutshell, is the care that is given to both partners to make sure that they can conceive in the future.
So meaning preconceptional care no kind of manifest. It means that before the conceiving, before the fight, I was all back hospital. bra midwife hɔ, bra doctor hɔ, na yɛnhwɛ answer, no, go through certain processes. So, Madam Wizard, is it every lady that must come for preconception care? Because if you like I said, yeah, ages, what are your different ages? 45, 20, yeah, we are going to be 20, it's too fair, so we may have a home back. 45, maybe, as a menopause reaction to a member. Do we have, like, is it every lady that's supposed to come for preconception care?
Okay, to talk about that, in our Ghana here, locality here, people don't normally go to the hospitals to check, to go and do voluntary checkups to see whether they actually can conceive or not. It doesn't really happen here. Even when people are pregnant, they stay indoors and they have some primitive ideas that when people get to know that they are pregnant, some people are going to look at them with some bad eye or some kind of that thing. Yes. So they don't actually come to the hospital often to do this. And it is something that it's worrying. In fact, it's when it comes to that, it is a very big thing that we are dealing with at the moment. The reason being that some people come in when the pregnancy has already graduated to, let's say, get into the second trimester. But in the normal sense, it is very advisable that if you are pregnant, you are supposed to, or before you even plan that I want to get pregnant, you are supposed to come with your partner, whoever you have met, even before marriage. It has to come before marriage. Preconception care should be done before marriage to rule out certain things and to know what you are going in for. Before you say yes to a guy or before you say yes to a lady, you are supposed to know certain things medically about the person to really see if you guys are really compatible and you can give birth to healthy babies. And some of these things are the resource incompatibility. We have something we call resource incompatibility, and that is just in a simple words, you have to know your partner's blood grouping. Let's say I'm O positive and my husband is O negative. Please, are you listening? Yes. If I'm positive and my husband is positive, O positive, the resource factors are either positive or the negative. So when there is a situation whereby let's say the guy is blood group negative, okay, and I'm negative, we are safe. If I am positive and the guy is negative, we are not safe. We are not safe. It doesn't it can affect the pregnancy. Sometimes it can even bring about miscarriages and abortion. And if care is not taken, there are some medications or injections that when you come and you realize that we give to the woman to make sure that it's build resistance of the red blood cells in the system of the baby, so that the mother's uterus or the lining of the uterus or the place where the baby is going to sleep can actually embrace the baby and it can help it to grow, but not see it as a foreign body and then bring it out. That is what come about if there is resource incompatibility. Secondly, aside that, sometimes people don't even think about knowing their partner's sickling status, and it is very, very bad. You are supposed to get to know the person you are going to get married to. You have to know their sickling status. Let's say that me like this, I'm AA. So some people even don't know what we are talking about, but they are genotypes, and this is in something that an inbuilt thing that we inherit from our parents. So sometimes it comes in the physical characteristics forms, and we also have it inside of the system, that is your bloodstream. So sometimes, if let's say there are some people that we call them way or your sickler, or we say that this person is a sickle cell patient. Those people, they didn't do anything wrong. Their wrongs are coming from their parents, simply because their parent didn't check whether their partner's sickling status was going to tally with theirs before they tied the knots. So now it's not only about the number. The moment you meet the lady, she's fresh, she's nice, you want her, everything in her is fine. But what else? What is the next thing? You're supposed to get to know all these things we're mentioning here to make sure to see that you're not going in for something that is going to make sure that in future your kids are going to suffer. Your kids can suffer because of a wrong choice, or because you didn't have preconception care, or because you didn't actually do thorough investigations before you guys came together. So some of these thorough investigations is you check your blood groupings, you check your, even the blood groupings, when you get to know, there are ways and means to make sure that nothing bad comes out of it. There is an injection that we call anti-D that we give before, through, and through pregnancy. So that is good. It can help us to actually, in the state of even emergency, when you already know your blood groupings, it is good that it will help us to attend to you as early as possible. And then when it comes to the sickling status, let's say that I am SS and you are a guy and you are AS. It's not good I get married to you. The reason is because I have SS, you have AS. So our offspring, or the children we are going to give birth to, they are likely to be either still AS or SS, because they're taking one from you and taking one from me. But I am already sickle cell, and I have the disease like sickle cell, the SS. So you have AS. The moment we get married, it means that our children may take one S from here. Definitely they will take my S. And you already have one S. So if they combine, that they also become syphilis. But then whereby I'm AA, I don't really care your sickle cell situation. The AA people, normally we don't really care about what you have. So until you are AA, you have to make sure that you will not go in for somebody who is also the same status like you, like SS or AS, or sometimes AC. Yes, we have those ones too, but they are rare. They are rare. They are not really in the system, but they are also there. So you have to get to know all these things to rule out some of these things we're talking about.
Okay, thank you. Said preconceptional care is not only for married couples. So single person like me, before I even get married, I need to start medical care. I need to start this preconceptional care before even I get married. So, Madam, you were saying something, and this question popped up. So, let's say I have this lifestyle. I'm into smoking, drinking, and I want to get pregnant. I have been coming to the hospital, you've been checking up on it, but still, it's not coming. What do I do next? Because is not working for me.
Actually, if you want to get pregnant, there are certain attitude and behavior that you are supposed to restrain yourself from. Though some of them may be addiction, but you seriously have to try to get yourself off it. If you have to see a clinical psychologist to help you, you are supposed to do that. Because if you don't do that, in pregnancy, or even if you're trying to conceive, there are certain behaviors that you don't do. Consuming of too much alcohol and smoking is not good for your health. It doesn't help. It breaks down the immune system. So it actually doesn't help somebody who wants to get pregnant. It doesn't help in so many ways. And if you are a man and you also, there are, like I was saying, when it comes to preconception care, we have the lab investigations that you are supposed to do. And we have lifestyle, your lifestyle, the way you live your life. What are the things I can do? What are the things I can do to get pregnant? What are the things I can't do? So to rule out all these things, you are supposed to see a doctor. You are supposed to see the specialist to make sure that these things are all ruled out. You're supposed to start fertility treatment. So you have to actually run labs to see if your partner actually doesn't have a low sperm count. If you, the woman, you also don't have some blockages in your tubes and other things. Because where there are blockages in the tube, That is what people call washing of the, yes,
Okay.
people call washing of the womb. And when talking about washing of the womb, actually, it only happens when you have been diagnosed. When you have been diagnosed, or when a doctor have confirmed that, oh, maybe you have severe bleeding, maybe you have some growth around the your womb, the tubes connected to your womb, or there is something wrong. Without that, you can't go and do womb washing, or we don't do that for you. So that actually is something we call D&C. We call it dilatations and curettage. The curettage and dilatations is penetrating through the tubes to make sure that to clear it's more like clearing the airways. Sometimes we actually do them when people get abortions, some people get malformations of pregnancy in there. That is when we do the womb washing. So until you visit the hospital to voluntarily that, oh, I'm a young woman, I haven't given birth before, I'm preparing myself towards pregnancy. So what are some of the things I'm supposed to do? You will be counseled. In fact, we will sit you down, talk to you about all these things you're supposed to know. And then afterwards, we will actually give you some thorough labs and scans to take to help us to know if your system is really ready and accumulative to have a baby, and a healthy one, of course.
All right. Please, viewers, don't forget to like, subscribe, share, and send in your comments. Your comments are really important to us. So please and please and please again, send in your comments. Okay, Madam Roses, can family planning affect preconceptional care?
Yes. Family planning actually can affect somebody's fertility, but it's affecting it is in a positive way and not in a negative way. Today, I want to stress on this because there are people talking a lot of things out there. Should you go in for any family planning method and then later you stop and you say you want to get pregnant and the pregnancy is not coming, please stop relating it to the procedure. You don't have to relate it to the procedure. The reason being that most of the family planning methods, apart from IUD and the permanent methods, if it is Depo-Provera, if it's Norwegian injections, if they are the pills, if it's the 5 years one that we do, or implants, if it's any of these ones, they are all hormonal family planning methods. And when we say hormonal actually it's simple. The system of every human being is made of hormones. Hormones are what helps us to be women and what helps men to be men. So with the hormonal system, these drugs are also made hormonally, like we use those things that are in the system to make it not artificially, we make it like that. So when they are made and introduced into the body, then it means that it either goes up or it balances your hormonal system. That is the estrogen and progesterone. So when these two are introduced into the system, then in that sense, they are going to help boost your womanhood. They actually help to boost your womanhood. So let's say the only thing is when they are introduced into the system, their work as hormonal family planning methods, their work is most of them, especially with the injections, they work on your eggs. They work on your eggs. So as a woman, they try to overcome the egg so that they don't actually grow. So acquired to say, excuse me to say, let's say I have this here. This is the egg. They are growing. And we introduce into the system something that will cover this. So this will not grow again. Even if it is growing, because it's the human system, some people have some strong system, or the hormonal balance, if it's very, very up, then it turns out that you might actually have some of the eggs growing. So you can have your menses, but you will not have it like you previously used to have them, because they have overshadowed the act of the egg. So now, instead of, or in the normal way, every woman is supposed to get all these ovaries to grow. And when the ovaries grow, I mean the eggs, when they grow, and then they get mature, they are waiting for a sperm to fertilize to make a baby. So if there is no sperm coming and I have gone, then it means that I stay in the place, nothing is coming. They will be waiting for a sperm to come. If no sperm comes, they comes out as menses, what we see at the blood flow at each of every month. Yes, so they come out like that. So now, because they have been shadowed and they are actually not growing to become big enough to mature, some people will not even see blood at the end of the month, and it's nothing. Some people will say that I'm not seeing blood, it means that the blood is accumulating in my system and it turns out to be fibroid. Please, these things are wrong teachings. People in the house are confusing you. That is why we say that if you have any problem, you're supposed to actually come to the hospital, notify us, and let us help you out. Some of these things you don't understand. You don't stay in the house for people to lecture you. You actually have to come so that we sit down with you, counsel you, and let you make a right informed choice with which one is good for your system. And then after choosing, we let you know how it's going to work in your system so that you understand what you are in for. Okay, so it actually affects it positively and not negatively. It boosts your womanhood. It helps you to become a woman because it adds up. We have also introduced an extra estrogen and progesterone into your system. So it's actually, some people even do depot and you see them now, they have shape. The ass will come, some people grow a bit bigger, especially the tiny ones. It makes them actually look sexy and nice. So it's good, and it helps in a positive way and not in the negative way like other people say out there.
So family planning does not affect fertility.
Exactly.
And please, as she said, don't stay in the house and let the house people teach you. They are not professional nurses. I'm go nursing school you. I'm your midwife. I'm baby kakra say Mammy yin say your cranny say no ye me ye bi. As from my system and a strong also system. Ain't see on your bar, me expectant mother. Please don't let them be teaching you falsely. So Madam Rosette, I'm on birth control pills, yes. A lady might be on birth control pills and she wants to now give birth. When is the right time to stop this birth control pills so you can give birth, like get pregnant?
The right time to stop. Okay, anytime you want to give birth. If you are on any family planning method and you decide that, oh, in fact, I want to give birth tomorrow, or next, I want to start giving birth, you can actually come and remove it. And we tell them when they come, we let them know that this thing you are going in for, even if you are coming for the 5 years one or 10 years one, and today you decide that, no, I want to get pregnant, you come and then we take it off and you get pregnant. If you are on the depot or the injection, the moment you stop, just give yourself like just a while, you can actually get pregnant. Personally, I have testimonies.
Oh,
Yes.
so when you're on the birth control pills, but I can't mention any of them. I'm not doing advertising for any of them. So when you're on the birth control pills, when you want to get pregnant, anytime you want to get pregnant, just stop it and you get pregnant. This is the Mom Diary Show. Please, as I said, like, share, subscribe. Send in your comments. We need to know what you really think about this preparation towards pregnancy. A lot of women are going to start. They are taking certain concoctions because they want to get pregnant. So please send in your comments so we know what you think.
One thing with regards to the birth control pill, some people are getting close to menopause. If you are in the line to menopause, menopausal age, let's say some people are 50 years, they can actually give birth. So if you have menopause, you are or you are you know that you are in your 45th year, 45, getting to 50 years. Sometimes nowadays 35 years even gets menopause. So the moment you realize that you get into your menopausal age, especially when you are very old, it's not advisable that you give birth, except you haven't given birth before and you are praying and praying on God for one. Even that, you are supposed to come so that we assess your system to see if you can hold pregnancy. Should you get pregnant? Because you can, some people can get pregnant, but at the end of the day, it can become life-threatening thing. You can actually lose your life in the process. So that is why you actually have to see somebody or consult a doctor to know whether you actually can give birth and what you can do and what's not, and then the age at which you give birth. Because when people actually tend to give birth in their late years, like 45, 50, most of them give birth to what do we call it? These kids that they call insuma.
Oh, okay.
If you don't deliver early, sometimes, especially if it's you have a history like that, you can actually have an autistic baby.
All right. An auntie in the village doesn't know anything about preconception. Like, has given birth to three. She wants to give birth again, and she's head of preconceptional care. What will make her go for this preconceptional care? Because already she has given birth to three babies that or they go into the hospital. So what will make her now? What will convince her now to go?
Okay. So with preconception care, it's very important, and its importance is supposed to let you know the life-threatening thing that comes into it. Because sometimes when you come to the hospital and we take the labs and we take you through the labs and all these thorough investigations like scans and other things, sometimes some people actually have some diseases they actually don't know about. But until you come, then it pops up.
Okay.
So it's more like you didn't come in for that, but you came to realize that, oh, me, I didn't know I have BP. When I went, I realized that I'm hypertensive. I didn't know that I was diabetic. It was when I went and I realized I was diabetic. And if you have such underlying causes, then it means that in your pregnancy, you need special care. So you have to actually know yourself and your system well, because there are some underlying things that you might not know. Then the moment you come to the hospital, it pops up. And then it helps us to help you so that we rule out complications in the near future to actually help you have a healthy baby.
Okay. I hope you've learned something. I have learned a lot, in fact. I took one bit that I have, but I'm putting it in my name. Whether you are married or not, you need preconceptional care. So, my dear ladies, my dear women out there, don't wait to get married before you start thinking of giving birth. Please, as a woman, preconceptional care is really important. Otherwise, we are prepared. What is at the top of the world? It's about what you say, you for war.
And before we sign out, I want your people or people listening to us to also know that folic acid is something that we have to add to our diets. Every individual, whether you are a man or you are a woman, you actually have to add folic acid, because the men, 5 milligrams daily, the men, it actually helps to thicken your sperm. And then the women also, it helps to take away some some defects that you might give birth to. Sometimes the children inherit some diseases when they are in the uterus. And when you are on folic acid, it helps to deal away with such complications. So the moment you are pregnant, it means that your baby is already healthy. Yes, so folic acid, some people add vitamin E, or any kind of I don't want to do adverts, no, but then anything, folic acid there, we know it, and vitamin E. So these things, you can add them to your diet to actually help you to boost your system, boost your immunity, and boost your womanhood or your manhood so that it can actually help you to prepare towards pregnancy.
Thank you so much for being with me. I am your host, Efwa Fowa, and this is the Mom Diary Show. Don't forget to like, share, subscribe, and send me your comments. And in fact, don't forget to also follow my lovely, gorgeous lady here, my guest here. But no fan, but don't forget to follow her. Her page name is Tell It to Rosette on Facebook and Instagram. Anything concerning health, please consult her. She's ready to help you out. Thank you so much for being with us. Until we meet again, it's a bye-bye. Mothers are the best treasures on earth. So mothers, please take care of yourself for us, okay? We love you.